Welcome everybody to the impact of climate change in cancer care experiences around the globe, a joint initiative from Cancer Trials Ireland, SLACOM, LACOG and OUCH. And we have an excellent panel of speakers this evening. The hashtag for this enterprise is hashtag LGCW 2024. So if people could post on social media to increase awareness of this topic, that would be wonderful. So our first speaker is Professor Eduardo Cazap, who is the president of SLACOM, who will be introducing this webinar.
We seem to have lost audio there for some reason, despite it working in testing.
Okay, that's these things happen. Let me just check that my settings haven't changed themselves. No, the settings are still there. That was working 2 minutes ago, wasn't it, when we did exactly the same thing?
Yeah,
we're just going to try it again. I'm going to stop sharing. And I'm going to start sharing again, just in case there was some sort of gremlin there. Make sure the sound is checked. Yeah, it is.
Good morning, good afternoon, good evening. I am Eduardo Cazap, President and founder of the Latin American and Caribbean Society of Medical Oncology. This session is a collaborative effort from SLACOM, the Latin American Cooperative Oncology Group, LACOG, the Cancer Trial Ireland, and Oncologists United for Climate and Health, OUCH. The main cause of climate change is human activities, which have increased the amount of gases in the atmosphere. Therefore, the acute impact of human health must receive increased attention, but little is known or appreciated about the effect of climate change on chronic diseases, particularly cancer. This webinar will provide a vision of what is known about climate change and the exposures it generates relevant to cancer in different parts of the world. In the context of the world cancer burden and the probable direction we could expect to follow in the absence of climate change, the effects that climate change is having on major cancers, from environmental exposures to ultraviolet radiation, global temperature changes, air pollutions and contaminants, disruptions in the food and water supply, environmental toxicants, and infectious agents is critical. It is also important to explore the effect of climate change on the possible disruption of clinical research and health systems that have been essential to cancer control practice. We hope that this session will promote the inclusion of this urgent topic in the cancer control agenda and favor discussions over potential responses and opportunities for interventions. Thank you very much for your attention and participation, and I hope that you will enjoy the webinar with new knowledge and challenging questions. Thank you very much for your attention.
Thank you very much, Eduardo. Our next speaker is Professor Joan Schiller, who is the chairperson and founder of Oncologists United for Climate and Health. who will give us an introduction about climate change and its impact on how we work and on our patients. Welcome, Joan.
Thank you. Thank you very much. And I really appreciate having the opportunity to talk to everybody. My goal today, my charge today, was to give a general background, excuse me, of what climate change is, as well as some of the general health effects that climate change can produce. Next slide. Great. So what exactly is climate change? Well, I know that all of you know it, but just to make sure we're all on the same page, normally the solar radiation from the Earth hits us, from the sun hits the Earth and is absorbed. However, some of that solar energy is re-radiated up into the atmosphere and out into space. So, some of the heat, however, is trapped in the atmosphere by what we call greenhouse gases and is re-radiated down to Earth, which is a good thing because otherwise we would have a frozen planet. Next slide. With climate change, however, there's a buildup of CO2 and other greenhouse gases in the atmosphere. These greenhouse gases trap the solar radiation and more of it is re-radiated down to Earth, resulting in a warmer planet. Next slide. This chart goes back 800,000 years and shows how much carbon dioxide has gone up particularly over the past several years and how very rapidly it has gone up. Next. In this slide, we're looking at the past 140 years or so from the start of the Industrial Revolution and when we were able to measure temperatures more accurately. And as you can see, as the levels of carbon dioxide go up, so does the temperature. Next slide. In September of 2023, there were a number of worldwide climate events ranging from heat waves to typhoons, droughts, floods, and glacial melting. Next slide. And needless to say, all of this is hurting our health. With climate change, we have increasing temperatures, more extreme weather, rising sea levels, and extreme precipitation. And this results in a number of impacts on our health, including heat waves, air pollution and water contamination, changes in vector ecology, increasing allergens, impacts on our food supply and quality, and population displacement. So let me just give you a few examples of that, starting with air pollution. Next. Okay. Air pollution comes from the burning of fossil fuels, and it contains particulate matter. This particulate matter is of various sizes, but the one that matters most to us now here is very small, 2.5 micrograms or smaller, and it has been rated as a class 1 carcinogen by the IARC. Next slide. PM 2.5 is small enough that it gets into the bronchial epithelium and terminal bronchioles, where it has local respiratory effects such as asthma, COPD, and lung cancer. It can also get into the circulation where it causes oxidative stress and systemic inflammation, resulting in cardiovascular effects and diseases. Next. Air pollution and PM 2.5 have been designated as a class 1 carcinogen by the IARC. It has contributed to about 13 to 14% of lung cancer deaths worldwide. It is the second most common cause of lung cancer, and it can cause lung cancer in people who have never smoked. There is also more and more emerging data that connects it with breast cancer as well. Next slide. The increase in precipitation and temperature from climate change results in increased pollen production and a longer pollen season. Next. And with a longer pollen season, the prevalence of allergies has skyrocketed. In the 1970, for example, in the US, about 10% of Americans suffered from hay fever, which is caused by airborne allergens like pollen and mold spores. By the year 2030, that went up to 30% of America. And the rate of asthma nearly tripled between 1980 and 2010. Next. We're also seeing an increase in vector-borne diseases. As the climate change warms up the Earth, it provides an expanded range for these vectors, as well as increased metabolism, increase in reproductive rate, and additional reproductive days and faster incubation. Next. And if you could play the video, which illustrates how vectors and therefore vector-borne diseases are extending their range. Next. Next slide, yeah. We're also going to see significant problems with how we handle and get clean water. We're going to be seeing heavier downpours, floods, contamination from agriculture, waste, etc., and more floods. Next slide. I think we all have seen, we've all seen these types of images. Next slide. Which is particularly brought home by the aftermath of the flooding in Valencia, Spain, in last month. Next. Health impacts from flooding include food and waterborne illnesses, food insecurity, interruption of emergency services, displacement of populations, mental health issues, and next slide, mold. In the wake of 2 hurricanes in the US, for example, heavy mold growth was identified in over 70,000 water-damaged homes. And infants, it turns out, who are exposed to mold before 1 year of age are 2.8 to 4 times more likely to develop asthma. Next. In addition to the expected effects the effects of drought that you would anticipate on drinking and bathing, drought result in a decrease in crop yield as well. And there's also the potential for pollutants to become concentrated. And in addition, droughts significantly increase the risk of wildfires. Next. Other effects of climate change on water include the risk of increasing growth of algae and bacteria, water contamination and flooding in homes, schools and businesses. Some of the waterborne diseases include typhoid fever, cholera, giardia, dysentery, E. coli, hepatitis, and salmonella. And these all cause diarrhea, which is the second leading cause of death for children under the age of 5 worldwide. Next. We are going to see more malnutrition as the we're going to see more, malnutrition as the land degrades. We're going to see nutrients changes in crops, wildlife declines, pollinator declines, fisheries declining, and water scarcity and population displacement. As an example, we've already started to see declines in spring wheat, winter wheat, soybeans, maize, and rice. Next.
Dramatic.
And as some areas of the world experience more drought, we are going to see more wildfires, such as this one in Greece in August of this year. Next. In 2020, North America was the only region in the world where air quality actually worsened due to all the wildfires. Next. And needless to say, extreme heat has a major impact on health, particularly in areas of the world already experiencing heat. Next. In addition to heat stroke and death from cardiac and respiratory failure, heat effects has other major impacts, including those on pregnant women and their unborn children. Next. And who's most at risk? Well, there's no surprises here, I guess. The most vulnerable among us are infants and pregnant women and the elderly. Next. Sea level rise is becoming more and more of a problem. Sea level has risen about 8 inches on the East Coast in the US in the past 150 years, and it's going to keep on rising as glaciers and ice at the poles melt. Next. Hurricanes, needless to say, have a major impact on our infrastructure. Next. The Philippines, for example, has been hit by 4 tropical storms in the last month, and I'm sure we're going to be hearing more about this by Dr. Guzman. Next. These are recommendations on how the healthcare community can prepare for natural disasters. Next. And I want to conclude by quoting the UN Secretary General Antonio Guterres, who has called climate change as a code red for humanity, saying the planet is on a catastrophic pathway and that humanity has opened the gates of hell. Next. And with that, I'll stop. Please consider copying this QR code and joining out, and I thank you for your attention.
Thank you very much, Joan. Excellent, an excellent talk, multi-layered and multi-sourced. Our next speaker is Dr. Gustavo Gossling representing LACOG, who comes to us from Porto Alegre in Brazil. Welcome, Gustavo.
Welcome, thank you. So I'm here to tell you about our experience with the floods in Brazil that happens in May this year. So please, can you go on with the slides? So just to tell you what happened, we had an unprecedented flooding in Brazil. We had millions affected and hundreds of thousands displaced due to this flood. Next, please. This is Porto Alegre, the southernmost capital, the capital of the southernmost state in Brazil. It has 1.5 million inhabitants. And the next, please. This is Canoas. This is actually the city I was born, and this is it before the flood. And the next, please. This is it during the flood. So you can have an idea of what happened. Next. Just to give you some perspective, this is the southernmost state in Brazil. It's Rio Grande do Sul. Rio Grande do Sul is larger than UK. It's larger than Italy. It's larger than Greece plus Austria plus Portugal in area. And 90% of our municipalities were affected by the rain, by the flood during that time. Next, please. So this gives you a good perspective on what happened. And I just wanted, next, please. I just wanted to tell you what we have learned and what we would like to share about it. Next. Cancer care is not the priority in the first heat. Next, please. In the first heat, our priority is actually saving people from the flood. And we could not make it to everybody, but the rescue is the first part. Next, please. As you can see, many ways to do that, to save people from the flood. And the next priority is how to give these people shelter, because not everybody could be held by their relatives. So, and the next thing that happened is that cancer then became a priority. Just after everybody was rescued, it suddenly became a priority, but you have a very, very big problem. The supply chain is absolutely disrupted. And when you have said disruption of a supply chain, next please, that includes not having access to the main access of the city, even though it has others, as you can see and imagine, it is beside the river. So half of the city is not accessible. And next, please, in the flood, we also lost the airport that just reopened 5 months after it. Next slide, please. What happened is that a humanitarian corridor was opened, and this was the main access to the city, to the southernmost capital of Roselle for the time. The most important access, at least, not the only one, but it was the one that had the most people traveling by the time. Next, please. And we have to know what priorities are. And I believe we as oncologists and as people who work in cancer care, we should advocate for prioritization of cancer care in the setting. And this is what happened actually. Next, please. When the humanitarian corridor was opened, we then had to set the priorities. And the priorities were: 1, next please, basic supplies maintenance. This includes food and water. And then health-related duties. This includes ambulances, transportation, and health workers' access to their jobs. Next, please. And then patients undergoing complex treatments, not only cancer care, but also patients undergoing dialysis, for example. They are included here also because this is very time dependent. Next, please. Another lesson that we believe is very important is that special needs still demand special treatment, even in these times, very difficult times. Next, please. So, as you can imagine, some patients with cancer cannot stay in the same shelters that other people could because of their special needs. So what happened is that next, a special shelter was opened to patients with cancer that had centralized donation of special equipment, including basic structure for ostomies and tubes, and basic structures for surgical dressings, and easier transportation due to centralizing closer and being closer to radiotherapy facilities that we know that can cure a lot of cancers. And this is what could happen. And another lesson is that if you are in need, you should prioritize as wisely as you can. And we happily have some tools for that. Next, please. For example, just 2 of them, the ESMO MCBS evaluation guidelines that help us prioritize treatments in the curative and non-curative settings, and the NCCN guidelines also have the basic resources and the core resources, which include what is actually essential to the patients. Next, please. Thank you all.
Thank you very much, Gustavo. That was very sobering, and some of what you said I had not thought about previously in terms of humanitarian corridors, etc. So thank you for those insights. For those joining us, we're going to do questions and answers at the end of the session in order to keep on time and to allow all the speakers time to speak. And so our next speaker is Dr. Ayodele, also known as Buki, who was a previous trainee, we were proud to say was a trainee of the Irish Medical Oncology program, and who's talking about the impact from Nigeria.
Good afternoon, everyone. My name is Dr. Olubukola Ayodele. I'm a consultant medical oncologist at the University Hospital Leicester NHS Trust. I'm so sorry that I can't be here with you guys today. It's London Global Cancer Week, and it's a really busy week for me. I want to say a big thank you to Cancer Trials Ireland and Professor Riley for the invitation to be part of this timely topic of the effect of climate change on cancer, and I'll be speaking from the Nigerian perspective. I have to say that I am not formally trained in climate health. My perspective on the impact of climate change stems from my practical experience as an oncologist, and my insights are informed by my lived experiences and observations, witnessing the impact faced by patients and healthcare systems. So today, I'm going to cover a quick introduction between the link between climate change and cancer. We're going to focus on the cancer incidence and outcomes in Nigeria, and hopefully this would raise an awareness and ways in which we can explore some preventive measures towards this big topic. So understanding climate change. Quick definition: long-term changes in temperature, precipitation, and weather patterns, but it's mainly caused by human activity. Now, I think this is what we need to remember, that it is human activities that's causing climate change, and human activities such as deforestation, industrial processes, and burning of fossil fuels. This is leading to a rise in temperature on the planet. The planet is getting hotter, and this is causing increased frequency of extreme weather events and altering weather patterns. So what's the impact of climate change on health? There's several. The direct effects include heat wave, extreme weather, air pollution. There's indirect effects on water quality, food security, disease vectors, and then also the impact on the vulnerable population, which are usually children, elderly, and those with pre-existing health conditions. What's the correlation between climate change and health risks? Multiple. For example, if we look at air pollution, because the earth is getting warmer, there's a higher increase in air pollution, leading to exposure to carcinogens such as particulate matter, polyaromatic hydrocarbons, and this is causing an increase in the incidence of lung cancers, particularly EGFR mutated lung cancers. When we look at ultraviolet radiation, which is coming from the depletion of the ozone layer, this is causing an increased risk in skin cancers, particularly melanomas, and then also environmental toxins from the flooding, their seepage into the soil, into the water, contributing to cancer risk. And when we talk about the Nigerian context, so Nigeria is one of the fastest growing economies in the world. There is a massive urbanization going on in the country. There's an increase in the use of cars. There are industries popping up in every corner of the streets, basically. And unfortunately, because of the kind of place where we are, things are not regulated, and there's such and this has caused such a devastating impact on the environment. The rise in temperatures with irregular rainfall. When I speak to my family, the constant topic of discussion is the extreme heat that is going on in the country. There's now an increased incidence of floods and droughts, and all of this is leading to air and water pollution. And if you look at the map in the corner, you look at the red and orange, which signifies the high risk and the medium risk areas in the country. Most of it are in the northern part of the country. And unfortunately, the northern part of the country are the places where there are the most vulnerable people, because that's where you have the lowest income communities located. Also, they produce a lot of the food in the country. So when you have such floodings like this, then there's a significant impact on food security and health problems in the country. So these pictures represent the recent flooding in the northern part of the country, and there was a lot of disruptions in health services, and we're not even sure about how much impact this is going to make on cancer incidence and outcomes over the next few years, because there was such an interruption to health services, prevention strategies, or going to the hospital for screening programs, or coming to hospital for treatment is the last thing on people's minds, and also they can't even get access there. Also, in the top, in the bottom right corner is what's going on in terms of drought. There's a lot of drought in the country, therefore there is significant reduction in food access in the country. And then when we look at air pollution in Nigeria, I think this one is the biggest problem that we are facing currently. There's a rise in industrial emissions and vehicular exhaust. Like I said, there are more cars, but the industries are springing up on every side. Nigeria has crude oil, and there are refineries in some parts of the country. In particular, somewhere called Port Harcourt is where one of the refinery is, and at the moment there is a big problem where there is black soot everywhere. So imagine where people are breathing in this black soot every day, there's going to be an increase in respiratory problems. Also, because we're not able to generate our electricity, there's a high use of something called generators, and generators is being fueled by petrol or diesel, which is constantly emitting all the CO2, causing a disruption in clean air. So this is a big potential impact on respiratory illnesses, cardiovascular illnesses, leading to premature deaths and comorbidities in patients. So imagine having cancer on top of this, there's problems already. So also, when we look at UV radiation exposure, it's unfortunate that we are located at the equator, so there's a higher impact in terms of heat, and there's a lot of outdoor movement in the country because people have to go out for their source of living. People earn their source of living daily, and people go out without adequate sun protection. But most importantly, they don't even know that there's a problem with this. There's a lack of awareness of preventive measures regarding ultraviolet radiation exposure. Water and food contamination, we've already talked about flooding, and because the farmers are experiencing a lot of difficulties with their crops, there's a higher use of pesticides and chemicals, and this is causing a higher rise in gastrointestinal cancers because of the higher exposure to carcinogenic substances in water and food. Also, when it comes to vector-borne diseases, Burkitt's lymphoma has been epidemiology linked with malaria endemic areas. There's a higher rise in malaria, and there's also an increased burden of infectious diseases, which is complicating cancer care and outcomes. There was this survey that was done in 2022 on people's perspective on climate change in Nigeria, and it was interesting that only 30% had heard of climate change. And out of those 30%, when they were asked on how they could make a change, 85% thought that it was down to the government or to developed countries to come and help. So it shows that there are big areas to help combat this. First of all, one of the areas is policy and regulation. We need to implement stricter environmental regulations. Those kind of burning, you can't be allowed to burn fires and fuels without having some form of repercussions. We need to promote clean energy and reduce emissions. Also, there's need for increased public health initiatives. We need to make sure that in a country where access to healthcare and cancer services is limited, we need to promote more prevention practices, so promoting cancer screening and early detection programs. But also we need to engage with the community in raising awareness about the link between climate change and cancer, encouraging community-led initiatives for environmental protection. And as healthcare professionals, our role is to make sure that we advocate for policies that address climate change and its health impacts. We need to engage in research to further understand the link between climate change and cancer, but most especially, we need to educate our patients and communities about preventive measures. We also need to promote healthy lifestyles and environmental stewardship. And definitely, climate change poses significant challenges to cancer prevention and treatment in Nigeria, and I think our call to action is a collaborative effort to mitigate this climate change effects in order to improve healthcare outcomes. And the future would be ongoing research, getting policies implemented, and engaging community for awareness. I want to say a very big thank you again for allowing me to give my views on this important topic. I'm sorry I can't be here, and if you have any questions, please do contact me on the email shown below. Thank you.
Thank you very much, Buki, for that perspective. Our next perspective is from the Philippines, from Dr. Roselle de Guzman, from Manila Central University.
Hello everyone, and thank you for joining us today. Thank you as well for the invitation to talk about the impact of climate change on cancer care in my country. The Philippines is one of the most disaster-prone places on earth, and this presentation will highlight the unique vulnerabilities of the Philippines to climate change, its effects on patients and the healthcare system. Tacloban City is situated in Visayas region, which is the central part of the Philippines, and it serves as a powerful example of the country's vulnerability to climate change. The city was directly in the path of Typhoon Haiyan in 2013. Haiyan is a super typhoon and one of the most powerful ever recorded. It slammed Tacloban with a storm surge and some of the highest winds ever measured in tropical cyclone. Haiyan caused catastrophic destruction in the Visayas, with several millions of people affected. Over 6,000 lives were lost, with thousands more injured and missing. While studies by experts didn't definitively state that Haiyan's strength was directly caused by climate change, we know that there is a strong connection between climate change and the increasing intensity of tropical cyclones. The Philippines is situated in a geographically challenging location. It is along the Pacific Ring of Fire and is highly susceptible to earthquakes and volcanic risks. It is in the northwestern Pacific Basin, which is the most active tropical cyclone basin in the world, and so the country is subject to the world record of typhoons every year, experiencing an average of 20 cyclones per year, and climate change is exacerbating this. With the changing climate patterns, the dry season is becoming more intense, with record-breaking heat and drought. The highest heat index recorded this year was a staggering 55 degrees Celsius, with thousands of schools shifted to online classes as students were experiencing nose bleeding. And one of my patients, who is a university professor, reported that a few of her fellow professors were rushed to hospitals due to severe hypertension and stroke. Conversely, the wet season is bringing more intense storms and typhoons. This year alone has witnessed a series of powerful typhoons that hit the nation. 5 destructive typhoons made landfall between the months of July and October, and this succession of extreme weather events underscores the growing threat climate change poses to the country. So let's consider the impact on patients. This one is a 68-year-old woman with early-stage breast cancer undergoing adjuvant chemo. She lives in a town which is the hub of jewelry production in the Philippines. The town also produces leather goods, and so a number of leather tanneries operate. She was exposed to waist-deep flood waters, potentially contaminated with harmful chemicals, and due to impassable roads, her treatment was interrupted. This delay, as well as her exposure to polluted waters, can have significant consequences for her cancer care and outcome. Another patient is a 55-year-old lady with metastatic breast cancer receiving treatment. She resides in a low-lying coastal area vulnerable to rising sea levels and flooding. She faces delays in clinic follow-up and systemic treatment due to high tides, and that highlights the direct impact of sea level rise on healthcare access. In order to adapt to the changing climate, she regularly checks the sea tide calendar and schedules her treatments and checkup during low tides. The stories of these two patients illustrate the real-world challenges that climate change brings to patients with cancer. What's not so commonly known about sea level rise is that it's not globally uniform. The Philippines is experiencing a higher rate of sea level rise, which is 3 times that of the global average. This poses a serious threat to the country's coastline, putting several provinces, hundreds of municipalities, and cities at risk. And it is projected that almost 17% of the Philippines islands could be submerged by 2100, potentially displacing almost 14 million Filipinos. The city of Manila is one of the parts of the world that's rapidly sinking, the most rapid rise in sea level seen in the last 20 or 30 years. There are other sinking islands and villages in the northern and central parts of the country, and these changes will have a profound impact on cancer care as healthcare infrastructure and communities are affected. When disasters strike, pre-existing health conditions including cancer often worsen, and this is due to degradation of living conditions, compromised immunity due to stress, inadequate nutrition, exposure to contaminated environments, physical injuries also sustained during disaster, and there may be weakening of support systems. Healthcare infrastructure also severely affected. Hospitals, clinics, cancer centers become inaccessible. Staffing shortages occur as healthcare workers are overwhelmed, or they may be unable to reach their places because they themselves are affected by disasters. The disruptions compromise multidisciplinary team management and create significant challenge in ensuring the continuity of care. So disruptions at any time over the course of cancer care might adversely affect outcomes. The disruption of healthcare access also can happen for displaced individuals. There might be increased risk of losing or damaging medical records and specimens, exposure to new environmental risks in unfamiliar locations, mental health issues, exacerbated by trauma or even depression, impacting their overall well-being. Economic challenges and financial strain add another layer of difficulty for them. Displaced populations often experience disruption of their social support networks, which are crucial for coping with illness and accessing care. Access to specialized care becomes limited in new and often overcrowded locations. So addressing the needs of climate migrants and displaced populations is a critical aspect of ensuring equitable and quality cancer care. The Philippines faces the harsh reality of climate migration and displacement, and the country ranks among the top 5 nations globally with the highest number of new internal displacements due to disasters. For this year alone, the Philippines recorded 2.5 million internal displacements. The country is making strides toward universal health care, and it is an ongoing journey aiming to provide access to quality health care services for all citizens. And the Philippine government's commitment to health care is further emphasized by the National Integrated Cancer Control Act. So this cancer law aims to improve access to cancer care services for all Filipinos. And the Philippines' ongoing pursuit of universal health care and implementation of the cancer law are definitely challenged by the impact of climate change. Based on this year's World Risk Report, Philippines is the most high-risk nation due to its extreme vulnerability to climate change impacts, exposure to natural hazards, the susceptibility of the population, and the insufficient coping and adaptive capacities of the society. A stark reality is that those who contribute the least to climate change bear the brunt of its consequences. The Philippines, despite its minimal share of global carbon emissions, is experiencing the impacts of climate change. Here are the maps of 2 major cities in the Philippines, Manila and Cebu. And the areas which are shaded in red are the affected areas by coastal flooding that may happen by year 2050. And experts predict that around 26.7% of the hospitals in the Philippines could face partial or total shutdown by the end of the century due to extreme weather events. So government agencies, the Climate Change Commission, the Department of Health, and medical professional organizations continue to raise the awareness on climate change, its impact on public health and healthcare system. There are national plans and agenda in place, and they are being implemented, and that demonstrate a strong commitment and dedication to adaptation and mitigation. Thus, there is more urgent need for global action to support vulnerable nations like the Philippines. Here's a photo of my grandparents' ancestral home, taken in 1975, and the other photo shows my grandparents together with some of my cousins when they were kids. And this is a place that captured joyful times, family reunions, celebrations, and the laughter of generations, and countless memories are contained within its walls. Now, as you can see in this recent photo, even the symbol of enduring family legacy isn't immune to the changing climate, with frequent floodings and strong typhoons, sometimes with water reaching halfway up the structure. So this is just one example of the very personal ways in which climate change affects us all. And just like this house, cancer care in the Philippines is facing the rising tide of climate change, and we cannot ignore the urgent reality. So around the world, it is impacting lives, the lives of our patients, it is impacting healthcare providers, and the healthcare systems. Thank you very much for your attention.
Thank you very much, Roselle, for a sobering presentation on which of all the 3 presentations really bring home the realities of climate change. And I thought your statistic of 0.3% of global emissions, yet bearing the burden of so much of climate change's impact, was quite telling also. The next part of our session is 4 talks looking at toolkits for people watching today that they can implement tomorrow. Our first speaker is Dr. Lisa Fox of the Institute of Cancer Research, who is a global expert on sustainability in clinical trials, and has led 2 pivotal papers in this area, which will probably become a standard of care for when many trials are considered in the future. Welcome very much, Lisa.
Oh, thanks very much for the kind introduction and for the opportunity to speak today. Next slide, please, Claire. So my name's Lisa Fox. I'm an Assistant Operations Director at the Institute of Cancer Research Clinical Trials and Statistics Unit. My day job is about the operational delivery of cancer clinical trials, but today I'm going to talk about greener trials from the academic trialist perspective. And the work I'm presenting is very much done in collaboration with collaborators at the University of Liverpool, Professor Paula Williamson and Jess here at the ICR CTSU. Next slide, please. So clinical trials are crucial to the development of new treatments. We all know that, but they have an environmental impact. We've heard earlier this afternoon about how cancer care can be impacted by climate change, but healthcare systems are actually contributing to some of the problem. We know that globally, healthcare systems contribute between 4 to 5% of global greenhouse gas emissions, and clinical trials are contributing to that total. So if we want to reduce the environmental impact of clinical trials, first we have to have a reliable way of quantifying that impact. And so I've been lucky enough to be involved in some work funded by the NIHR in the UK to develop a method and guidance for carbon footprinting clinical trials. And the links to the two papers, which Seamus kindly mentioned, are here on the slide with the high-level results of some of that carbon footprinting that we've done using our method and guidance. You can have a look at that detailed results and the hotspots that we're starting to see, but the message for today is anybody could use this guidance. You don't have to have any prior experience of carbon footprinting. Everything you need to know is within those guidance documents and the data collection tools that we've included in the appendices of the paper. You can use this guidance at any stage of a trial, at the design stage, once a trial is in progress or once it's completed. And we also provide open access free regular training sessions for anyone who wants to learn how to do this and get support in its application to their own trials and their own portfolios. So we're very much at the beginning of this work, and we've got this guidance now. We know we can produce a footprint of a trial, and now we need to do lots more work to understand the results that this produces and how we interpret them and use them to help us enable lower carbon clinical trials. So we've got lots of work coming up in terms of developing tools to support the community and kind of supporting the paradigm shift to this, the use of this guidance being routine. We want to build our evidence base, start to analyse those hotspots and identify and assess mitigation strategies. Next slide, please. But as academic trialists, we're just one small piece of a very complex puzzle, but we're collaborating across the clinical trial sector to work together to address a common problem. So we're working closely with the pharmaceutical industry, and our guidance document fits within a common methodology framework that we've developed together with industry. We're also in discussions with regulators, policymakers, patients and the public, parallel initiatives ongoing internationally, the NHS as our UK health system, and academic funding bodies. And some of these partners are starting to set incentives that will help drive uptake in the community. Next slide, please. But while this huge amount of work is ongoing, we don't have to wait for this to become available. As Seamus mentioned, there are things that we can all do right now to help reduce the impact of our work. In recognition of the kind of groundswell of interest in this area, the TMRP Trials Methodology Research Partnership in the UK have convened the Greener Trials Group, and this has membership from the UK and internationally. Anybody interested in making clinical trials greener, so methodologists, trialists, patients, policymakers, funders, healthcare providers, trusts, clinicians, publishers, etc. It's become a forum for collaboration, dissemination, to help us set the research agenda, and through that group we facilitate these drop-in clinics for anyone who would like training in this area or to learn how to use this guidance to look at the footprint of their trials. So if you're interested in joining the Greener Trials Group or accessing these training tools, please just do drop me an email. There's also plenty of resources available and knowledge that we can all tap into right now. That TMRP Greener Trials Group has a website, which I have added a QR code to the slide. We're trying to start to collate tools and resources that will help enable lower carbon clinical trials. That includes really good existing resources such as the NIHR's carbon reduction guidelines. The UK CRC has developed some guidance on how to make monitoring greener, and the UK TMN have a chapter on sustainability in their recent guide to efficient trial management. We're starting to know where those common hotspots are within our trials, and all of us can look at those areas within our own trials to see how we could make them less impactful. So sponsor emissions, sponsor travel, trial-specific patient assessments and patient travel, and laboratory are some key kind of hotspots that we could all start to consider. Next slide, please. So as I said, we're just at the beginning of this work and we've got a huge amount to do. I won't go through the detail of what we have planned, but we need more data on publicly funded trials, and we get that data by people using this guidance and applying it to real life clinical trials, and then sharing the kind of findings that they find so that we can put that back into our guidance and make it available for future users. So if you're working in the area of clinical trials, we'd love to hear from you if you're interested in using our guidance. We need to do the work to reduce the footprint of clinical trials, so we need to analyse accumulating data, look at the mitigation strategies and appraise them, and look at behavioural science considerations as well to see how we can support engagement, and most importantly, move forward together, so continue working across the sector with patients, the public, industry, healthcare providers, and regulators. Final slide, please. Which just leads me to thank the many partners and collaborators which we work with on this project. Thank you.
Thank you very much, Lisa. The next toolkit is medical oncology. So my brief is to outline what we can do in an oncology clinic tomorrow to reduce, next slide, to reduce future patient climate change related suffering. Next slide. So as an oncologist, what I prescribe transforms lives, but how I prescribe worsens climate change. This impact is multifactorial. A 2019 study showed that the emissions of pharma were 1.5 times that of the automotive industry. My footprint extends to data storage, travel, food, waste disposal, and financial investments of healthcare organisations. The plastics we use in regular cancer care need oil to manufacture, and subsequently they can become carcinogenic microplastics. And you can see the theme here for Earth's Day 2024 was Planet versus Plastics, a reminder of the pervasive impact, negative impact of plastics on our environment. Next slide. When we think of cancer medicine, we think of quality adjusted life years, which is a benefit of our treatment as a way of improving lives. But there's also a concept called DALYs, disability adjusted life years. And US healthcare emissions per annum lead to loss of over 7 million future years in good health, DALYs, and an extinction of 14 terrestrial species. The carbon footprint of and environmental impact of healthcare is equivalent to that of the continent of Africa. As a medical oncologist, it's been calculated that the emissions I generate account for 1 to 4 would be similar to 1 to 4 rocket launches a year. I cycle to work. But my online activity is the equivalent of driving a fossil fuel car over 30 miles a week, according to Net Zero Scotland. Next slide. So what can our oncologists do? I think the first thing that we can do is to prioritise preventing cancer by promoting screening, prevention, and health promotion in our patients and in society, such as smoking cessation, compliance with screening programmes, lifestyle medicine, and vaccination. Next slide. The second thing is that up to 20% of what we do is wasteful. 6 to 8% of healthcare spending is accounted for by over-treatment or low value or unnecessary care. And in the United States, a survey showed that 22% of medications, a quarter of tests, and 11% of procedures were unnecessary. Things like guidelines, as we've seen here with the Choose Wisely campaign and one from MD Anderson, where they've de-escalated screening and scans in patients in routine follow-up. And Choose Wisely Canada, where they have very clear infographics in terms of more is not always better, and have partnered with patients because patient engagement is a significant part of reducing over-treatment and partnering with them to demonstrate that more is not always better. Next slide. The third thing we can do is to engage with climate change task forces. This is the ESMO Climate Change Task Force meeting in Barcelona Barcelona this year, which looked at updates in the area and things that could be done in the clinic tomorrow to reduce the medical oncology burden. They've also looked at how ESMO can work better in terms of more hybrid events, reducing the amount of printed material that are available, using plant-based catering, and reducing plastic usage. And there's a portal that they launched at the meeting, the Climate Change Task Force portal, which is a curated portal of information for medical oncologists on planetary health. Next slide. There are toolkits that we can use in the clinic. The Royal College of Physicians have one looking at reducing testing, generating less waste, participating in a green team, advocating and reducing unnecessary prescribing. And there's also the GLASS toolkit. GLASS is the Irish for green, and this is one done by the Irish College of General Practitioners. And it's a really useful one in terms of our practices, because it doesn't just cover what we prescribe, but also discuss things like practice management that we can use in our daily office lives. And also the importance of lifestyle medicine and healthy living promotion, which has also planetary benefits. Next slide. In our oncology practice in Ireland, our trainees looked at the National Drug Formulary, which is 300 medical oncology prescription protocols, and found over 1,000 sustainability touch points in it. This was published last week in the Journal of Clinical Oncology, Oncology Practice. And as a supplement to this, we've translated the infographic into 7 languages, including Portuguese, to make it less Anglo-centric and also make it more disseminatable. The plan is that this would serve as a wallpaper in in Oncology Day Ward. And I just want to discuss this in more detail. So what you can see here is that, next slide, that we talk about switching from oral to oral medication. So when we prescribe IV Panadol, it has a carbon footprint 50 times that of oral Panadol, and is often equivalent. And the same would apply to many oral antiemetics and oral anti-cancer agents. It would apply to hydration solutions. We think of antibiotic stewardship in our clinics and hospitals because of the resistant antimicrobials, but really we should also think of sustainability stewardship, which would look at procurement, which would look at how we practice, which would look at curating diagnostic and other tests. The use of telemedicine to reduce hospital visits has been shown in palliative care settings to be as effective, but allows for better patient contact and more patient contact relative to in-person visits. In lifestyle prescriptions, when we look at diet, 14% of greenhouse gas emissions are due to our animal-based diet. But there are studies looking at increasing microbiome diversity in patients with melanoma using increased dietary fiber, which show that the response rates are 30% greater in those patient populations. So lifestyle prescriptions in terms of diet prescriptions may have an added advantage to our patients in terms of improved cancer outcomes. We also need this infographic also reminds us about the importance of deprescribing and other things that can be done in the pharmacy, like dose banding and vial sharing, which are also cost saving. So many of the measures here will also reduce, not just reduce climate toxicity, but also financial and time toxicity for patients and for healthcare systems. Next slide. In medical oncology, we've learned the languages of targeted therapy, of genetics, but we need to learn the language of, and we also have learned the language of patient participation, which featured in Lisa's slides in terms of improving change. So this is an example from my hospital. It's called I Told You I Was Ill. So the first author is an artist. His paintings are here, and the remainder members' authorships are the neurology team that looked after him. So this was a very rich experience and an excellent paper for everybody to learn from in terms of providing care. But we also now need to learn the language of planetary health in terms of how we look after patients today. These other references, Greta Thunberg's book, The Climate Book, is an excellent resource for getting up to speed in this area. And Nature Anthropocene have a weekly email briefing, which comes to your mobile phone and is a coffee cup read in terms of what's happening in planetary health today, and is a very reliable source in terms of learning what's increasingly important to our patients and our families. Next slide. Finally, as Joan has talked about, we need to be advocates. So the system our patients and our families need is a climate resilient healthcare system with climate transformative leadership and governance, climate smartness integration. As Gustavo Buki and Roselle have mentioned, we also need a climate resilient healthcare system in addition. To achieve this, we need to become engaged and move the dial in terms of being pure scientists or pure medics, to issue advocates. It's very hard for politicians to build the systems our societies need today, which often involve compromise and change for vested interest in our society and for our citizens. If among the most trusted professional groupings in our societies are silent. Next slide. Finally, knowing is not enough, we must apply. Willing is not enough, we must do. Our aim is and hope is that today's webinar will lead more of us to both apply and do. Thank you very much for listening. Our next toolkit is from Professor Katie Lichter of the University of California in San Francisco, in the terms of the role of radiotherapy and toolkits in radiotherapy.
All right, good afternoon. Thank you for allowing me to talk about the topic of integrating environmental sustainability into cancer care and what are some tools that we can do to start to do this. So as you've heard from many of the other presenters and conversation today already, we know that climate change impacts cancer care. But simultaneously, cancer care is known to contribute to pollution and greenhouse gas emissions and climate change more globally. And this certainly includes the delivery of care. We know that all components of oncology care have a footprint. This includes surgical oncology, medical, the chemotherapies and drugs utilized, and even radiation. Essentially, all care processes do have an associated footprint. This is just one study that our team looked at that did a very comprehensive study, is now published in Lancet Oncology, showing that even radiotherapy has emissions related to it over the course of a patient's treatment. Most of that coming from patient travel and building equipment, but also from medical supplies. But we know that daily practices, including conference travel, also have a significant footprint. So we did a study looking at one of the largest oncology conferences that is hosted each year in the US in Chicago, and looked at the number of attendees, which actually can have over 40,000 per year traveling to Chicago, and looked at the emissions associated. Interestingly, we saw, when individuals are coming in person prior to the COVID pandemic, these emissions were rather high. But actually during times of the COVID pandemic, when this switched to an online virtual attendance, we saw this drop. And so our idea was then to look at what about post-COVID in new hybrid formats? What does that look like? And where are there opportunities to mitigate that? So as mentioned before, when it comes to conference travel, actually most of it, unsurprisingly, does come from travel itself with associated emissions, certainly for the other components of conferencing, including the conference, the host, where it's hosted, but also some the hotel stays. And we know that if percentage is hosted virtually, even 50% being virtual, certainly we see a reduction of emissions that's associated really with the amount that are virtual. And so attending conferences, there are certainly many pros and cons. We cannot ignore the pros of networking and learning and innovation and coming together. But simultaneously, there are also cons associated with it, including, massive sorts of emissions, but also inequities when people cannot travel, across the nation or, internationally for that travel. And so in this complex decision-making that each of us need to make, or even departments need to make, what if we had an easily accessible decision-making tool? And that's where I would like to introduce you all to a tool that our team put together called Network Greener. I'm just going to run through it here today, but really encourage folks to jump on and try it out themselves and play with the tool. So in our tool, Network Greener, it actually allows individuals to put in the details of their travel plans. This includes whether they're traveling by plane, car, biking, or even walking, where they're coming from and where their final destination is, how long they're staying, and then information as well on where they're going to be staying. And then once the individual puts this information in, it actually spits out or calculates the associated emissions. So this will give you the carbon footprint, the amount of emissions that are estimated, the distance that the individual travels to the conference, and then additionally, what offset emissions would be if the individual decided to virtually attend. One component that I really enjoy about the tool and highly encourage, again, individuals to play around with is we suggest, what are some everyday lifestyle changes that could be undertaken to offset the environmental impact? So you can see what it would mean to be vegetarian, eat less animal products, to recycle for a year, reduce food waste, and can see how these different lifestyle offset changes could impact or could offset some of those emissions, keeping aside from actually purchasing offsets. Additionally, we thought, oftentimes individuals may how to look at this in a broader context besides just the individual themselves. But what if conference hosts want to look at if they permit this hybrid attendance? Or, what if a department is thinking about sending a group of individuals to a conference? And so this calculator, rather than choosing to look at it from an individual level, you can also look at it from a conference organizing perspective, or even as leadership, and can look at how many participants are planned to attend in person, and then how many international participants are expected, and then can see just by allowing or making the conference have features where different percentages can be virtual, that it shows the estimated range in waste and how much that can be reduced by really allowing for that hybrid format. So really encourage individuals to utilize this or to share it as we think about moving forward and putting together conferences. So, please feel free to scan this QR code and go check out the calculator. But one other thing I really want to highlight is, other fields outside of healthcare have begun to build models off of data, really data from life cycle assessments, similar to what we did in radiotherapy, where you can look at different components of your process and actually calculate those emissions, almost like a nomogram that we frequently use in cancer care. And so again, the question is, what if we had a decision-making tool in cancer care for both providers and patients to be able to estimate and have transparency around what the potential emissions may be for an entire care pathway? And what if you change components in those care pathway without changing the safety or the efficacy of treatment? And so utilizing our life cycle assessment, this is exactly what we are trying to do with with the data that we have that spans numerous institutions across the US, just looking at radiotherapy, to start to build out a nomogram or a predictive tool like this. So right now, our team is looking at, when we have constants for treatment in radiotherapy, when we have known components such as consultation, SIM, treatment, and OTV, and supplies, there are variables that really impact the amount of emissions in the end. And that's going to be, the number of patients treated, the distance that the individual is traveling, the number of fractions that they'll receive. Sorry about that. The number of fractions that they'll receive. And from this, we can actually calculate CO2 per treatment course. This is something that we are really excited to be working on right now and look forward to publishing in the future. And so just encourage you to follow along as we work on this. So thank you for the opportunity to present.
Thank you very much, Katie. Our final speaker, welcome Shelley from Shelley Hwang from Duke University to discuss toolkits in surgery.
Yes, good afternoon, everyone, and thank you, Seamus, and the conference organizers for letting me just spend a few minutes talking with you about some toolkits and ideas around greenhouse gas emission reduction in the perioperative environment. Next slide, please. So we've heard some incredible informative background information about both the impact of climate change on health and the impact of healthcare on the climate. And just to add to this, if the global healthcare sector were actually a country, it would rank as the 5th largest greenhouse gas emitter in terms of the magnitude of waste that's the result of healthcare. In the United States alone, the healthcare sector makes up almost 10% of all greenhouse gas emissions. And the reason that I feel so strongly about this is that as a surgeon, somewhere between 1/3 to 1/2 of greenhouse gas emissions that are produced in the healthcare industry are directly related to the activity that occurs in the operating rooms. If you look on the left, the climate change literature will divide the kinds of emissions into 3 different categories. And the composition of all 3 of these categories have increased and continue to increase since they were first measured in 2010. Next slide, please. So why is the perioperative environment so problematic? I think a lot of this is evident to most of us, but it is related to several different factors, not least of which is the high usage of single-use disposable materials, particularly in industrialized countries. The impact of climate change of the perioperative environment includes all components of the supply chain, including manufacturing and transportation, and that includes supply chain transportation as well as patients getting to the operating rooms and home again. And then very importantly, the disposable of medical products and equipment, with single-use equipment being the predominant usage in countries like the United States. The operating room is especially a target for a reduction of biomedical waste from disposable of tissues and organs and other biologic materials, which are a direct result of what we do in the operating room. And one less recognized component of greenhouse gas emissions in the operating room are from anesthetic gases such as nitrous oxide and desflurane, which are even stronger greenhouse gas emitters with a much higher global warming potential than carbon dioxide itself. So the awareness of these sorts of opportunities for reduction of greenhouse gas emissions is quite critical and very relevant to the perioperative space. Next slide, please. So earlier this year, there was a scoping exercise that was published in the surgical literature, which tried to identify over different continents the scope of sustainability initiatives that have been published. There were 163 studies that were evaluated, and you can see here where the sustainability initiatives have gained traction. So the most commonly started initiatives are in the reduction of greenhouse gas emissions and reduction of waste and waste management. But there's also opportunities for education in terms of climate change training, reduction in the use of resources, and very interestingly, staff-led sustainability initiatives, which have really been a grassroots type of activity in many operating room environments. And then, of course, there are recycling initiatives and creating sustainable OR committees. So these are all activities that are currently ongoing. They are just starting to get off the ground in the United States. I think Europe is a little bit ahead of us, but certainly it's starting to get much more in focus for surgeons who are actively practicing, particularly in the area of oncology surgery. Next slide. So I want to just give one example of how operating room committees in individual institutions are making a difference. This is an example of one greenhouse operating room committee in Carolina that stood up a committee which included a multidisciplinary and multi-perspective group, including corporate leadership, nursing and anesthesia, and operating room staff, in addition to surgeons. And they engaged in a multi-pronged approach, including opportunities to recycle, focusing on reduction of energy and water, and reduction of solid waste in the operating room. So this was a four-pronged approach, and you can see here that recycling resulted in annual solid waste reduction of about 13,000 pounds. One initiative was around disposable OR foam padding replaced with reusable gel pads. Another was a power down initiative to turn off all anesthesia and OR lights. And then just simply converting from soap to alcohol-based waterless scrub. All of these together were very effective in saving OR utilization of energy and reducing greenhouse gas emissions. Next slide, please. What's really exciting for me in this space is that, as you can see from the previous example, there are lots of opportunities where there's low-hanging fruit. And in addition, I think most of the studies reported highly motivated stakeholders who are unified in their perceived threat and understanding of global greenhouse gas emissions, both in their personal lives and in the professional environment. And with this charge to action, these individuals tend to be very motivated to make change that is needed to start affecting this problem. I think many individuals are willing to take personal time to work on these initiatives themselves and to train the next generation. And there are plenty of opportunities that we can identify to reuse drugs, supplies, and equipment. Next slide. There are important barriers, though, and I think what we're trying to address briefly in some of the presentations is there's a lot of opportunity for training and information, and we really need to engage more further on these activities. There's inadequate access to recycling facilities in many institutions. There is a culture in general in the perioperative environment, especially in the United States, that have not focused yet on the importance of reducing OR waste. And I think there are opportunities that can address some of the issues of lack of leadership, lack of awareness or understanding, lack of institutional engagement, and lack of time, all of which we need to overcome and prioritize if we're going to make a difference in this area. Next slide. So what do we do as next steps? Well, I think I've shown you that having just a grassroots OR committee with like-minded stakeholders who have an interest in this can actually make a difference. And I think if many institutions start these activities, then I think together we can actually make a big difference. Additional research is needed clearly to understand the environmental impact of some of these initiatives. And I think the previous speakers have mentioned how important it is to have reproducible metrics to determine the impact of such initiatives. And the future goals will be focused around decreasing the negative environmental effects of the operating room environment, clearly without sacrificing the health and well-being of our patients and providers. Next slide. So I wanted to thank Seamus and the conference organizers for the opportunity to talk about this very important topic and to be able to learn from everyone else. Thank you.
Thank you very much, Shelley. That was excellent. And thank you all of the speakers for your excellent presentations. We have a short amount of time for questions. There are one or two comments in the chat about air pollution in Lahore, which is among the most polluted city in the world, smothered by smog, apparently. So I guess what I would like to ask each of the speakers is if they could do one thing, what would they do today to increase awareness of sustainability and integration of sustainability in how we work? I guess that would be for the speakers on the toolkits, and I guess for the speakers who spoke about the impact on their societies, what message would they have? So maybe if I could start with Joan, because your face is the first on my screen. So, thank you.
Can I say I would redo the elections? the presidential elections. I think that would be the biggest help. I just think we need to keep on reinforcing our message and doing whatever it takes to get our message out there. Because I think the more people that are talking about this, the more likely we are to be heard. And whether it's giving more presentations and sessions such as this, or I'm sure many of us in our institutions have what we call in the States grand rounds, where you could invite people to give talks. I'm sure you could do it virtually these days. I think we just need to really, I mean, some of what we saw today was really gut-wrenching. And I think if more people saw stuff like that, they would be more interested in this topic.
Thank you. Gustavo?
So related to what happened here in Brazil, I think there is nothing that can get you that prepared for this kind of event. However, if you have a very structured plan for these cases, it is really, really, really important. So the awareness goes beyond the public itself, but it should be especially in the government.
Lisa?
I think from my perspective, I think the best thing we can do is to find networks of other interested people and kind of bring those networks together and kind of bring the idea of sustainability into our networks that may not be about sustainability. So all those kind of day-to-day work that we're doing, bring the conversation around to sustainability, and so much of the solutions that brings kind of environmental benefit also bring financial benefit and a lifestyle benefit and a health benefit. And I think we need to kind of realize those co-benefits and kind of bring that into as many discussions as we can and find a network of people who have a personal interest and try and build from there.
Shelley?
Yeah, I'd like to amplify what Lisa said. I think there's a very nice opportunity that we all should avail ourselves of the professional societies that we're part of. I think those are really great opportunities to have advocacy around this issue. And I think myself and other people like me have started to engage in creating task forces as part of professional societies. That's something that's easy to do. There's an audience that's already built in. And I don't think the lack of domain-specific knowledge should really be a deterrent, because we all care about the planet. And I can tell you that since I've done that, I've learned a tremendous amount about some of the small daily things that we can do that will affect change. So don't be shy and reach out to people you know.
So I guess we would hope, I think a wise patient at a meeting said that he uses information to educate and stories to motivate. And I think that we are going to record the session and have it available on the Cancer Trials Ireland website, because I think it would be a tremendous resource for people giving talks in to medical communities and grand rounds to hear the testimonies of those affected by this. That's very powerful. And I think it also brings an immediacy to it. And I think the other thing that I would, that is, as part of that, then I think it's the importance of keeping advocating in this area. It took a long time for the medical community to get involved in smoking cessation, but we all recognise it's a huge issue, and I think this is a much more complex, nuanced area, but the threat is greater than cigarette smoking to our patients and to society, and that needs to be addressed. I'd like to thank Claire Hopkins, who's beside me here, who's not on camera but she's there.
Thank you, Seamus.
And to say thank you very much for all of the huge effort that has gone into making today work. I'd like to thank our speakers for their enthusiasm and for putting up their hand and saying yes when invited. I look forward to publication that will occur from this that will help our patients in our communities and our children and their communities. So thanks very much for everybody for joining today and for spreading the message and for being involved. It's a hugely important topic, and it's wonderful to see engagement on this area. Thank you all.